Okay, today we're going to demo how to assemble and disassemble and identify the parts of the anesthetic aspirating syringe. Okay, and this is our little tray setup, so we'll put it off to the side for now. The first part is going to be your threaded tip. Okay, the second one is your harpoon. I don't know if you can see it, but it's a nice picture in the book also, okay? Third is going to be your piston rod, and this is the part that holds the harpoon, okay, that the harpoon is attached to the end of it. The fourth is the barrel. The barrel is the part that's going to hold the cartridge or the corporal. Fifth is the finger grip, okay? Sixth is the finger bar, which this one doesn't have it, but it's an extended little piece of metal that then you're able to put more pressure on it. Okay? And the last one is a thumb ring. Okay? You always want to make sure that the thumb ring is screwed on correctly and tight. Okay? You want to make sure that it doesn't come off when the doctor goes to administer the anesthetic, and you want to definitely make sure that it doesn't fall off when you go to engage. Okay, very important. Okay, so these are the parts of the anesthetic aspirating syringe. The next part that I want to go over is going to be the needle. Okay, and this is going to be a short needle. It's a 30 gauge. Okay, we'll talk about that in just a minute. Back here at the end, the part that you take off is going to be the cartridge end of the needle that's going to go inside the cartridge. Okay, and I'm going to skip one of the numbers because it's very important that you know this before, that to open this you have to turn and break the seal, and you'll hear a little snap when you do that. It's very important that if it doesn't snap, if it's already broken, that you don't use it. That means it's been contaminated, maybe it's been tampered with, but you always have to hear that little snap when you break it, when you break the seal. Okay. All right. So the end that when you break the seal, you take off the little short end. The little bevel is going to go into the cartridge end, and then you'll have the aluminum, the needle hub, and this one just so happens to be aluminum, which as I said in class, I prefer the aluminum versus the plastic because if you're in a hurry and you're putting it on or you're transferring needles or something, if you don't thread the plastic one correctly, then you've messed up that needle because it's plastic, and the threaded end here is metal, so plastic against metal, it has a tendency to deform it, and then you've messed up that needle. And also it has a tendency to keep turning on you. Okay. The other part of this is that the 30 short is a 1-inch needle. Okay, it's a 1-inch needle. The gauge number indicates the diameter or the thickness of the needle. Okay, the larger the gauge number indicates thinner needle. So this is a 30, so it's going to be thinner than a 25 gauge or a 27 gauge. So the larger the number, the thinner the needle. Okay, so this is a 1-inch, and it's a 30, so it's thin. Versus this one here, that's going to be, this one here is a 25 gauge, okay, and this one is, like I was saying, has a plastic hub, okay. The needle for this one is 1 inch and 5/8, 1 5/8, okay? So it's going to be thicker. And normally you would use the shorter one for the maxillary and the longer one for the mandibular. That's kind of the basic standard use of the needles. However, it varies on the dentist, okay? Occasionally the dentist may need to use the blue at the bottom or the yellow at the top. So it just really depends on the dentist and what they need when they get in there. Okay. A little trick that I use to remember is that blue is for the upper, and I usually think of blue as the sky, so I always kind of remember that blue goes up, sky is blue, so maxillary. My little things that help me. This one happens to be white, but some of the ones that are most common in the dental office are the 27, which are a yellow one. Again, varies on manufacturer. Okay. Let's see. The next part we're going to talk about is going to be the cartridge, okay, or the carpel. It's also known as the carpel. The rubber diaphragm here, right, the little black part there. The book always tells us, or suggests that we keep these in the blister packs that they come in, okay, as to not to contaminate, and also it's safer to keep them in there so they less chance of falling and breaking. Okay, to wipe the tip of the diaphragm with alcohol gauze, okay? And you should never touch that part with gloves, without gloves, unless you're wiping it with an alcohol, okay? The second part to this is the aluminum cap, which holds the diaphragm in there. The glass cartridge, also known as a carpel. The color-coded band indicating the type of anesthetic, okay, and that's required by the American Dental Association, by ADA. And the back end of this is a silicone rubber plunger, and this is where the harpoon of the syringe is inserted into the silicone rubber plunger when you engage it, okay? A thing to know about the anesthetic is that the ratio of epinephrine, okay, in here, and this happens to be a 1 to 100,000, 2% xylocaine, okay? The ratio of epinephrine, the lower the second number, the higher the percentage of vasoconstrictor, okay? It's all printed on the cartridge. So example, if common anesthetic is 1 to 100, okay, versus a longer lasting anesthetic that has a higher percentage of vasoconstrictor is 1 to 50,000. So what it's saying is that the 1 to 100,000 has less vasoconstrictor in it than the 1 to 50,000. So there's more in the 1 to 50,000. And you can find out all that information here on the carpel, okay? Let's see. This happens to be a needle holder, and we'll show you. This is one kind of needle holder. It's called a jenker. It's more like a paperweight. Okay. These are the protector. These are just a needle sleeve prop. It's a little cardboard with a hole in it. We'll show you how to use those. Okay. One thing you want to do before you engage the needle, assemble the syringe, is always double check the thumb ring. Make sure the threader is on tight, okay? The book will tell you 2 different ways you can do it. You can insert the needle first, okay? And then you can do the cartridge. You can do that. I prefer to do the second way that it talks about, which is insert the cartridge first and then put the needle. Just because you have a tendency, if you put the needle in first and then you put the cartridge in and you didn't do it correctly, then you have a tendency, a possibility of bending that needle in here or poking it twice if you have to reposition the cartridge. So in the syringe, you want to hold it with your thumb and your index finger from the thumb grip. Okay, for the finger grip, and you want to pull down on the syringe. Okay, there's a little spring in there that you can pull down. You can see here how when you pull down, it pulls back. Okay, you pull it back, you take the cartridge, you drop it in with the rubber plunger towards the bottom, the diaphragm towards the top. Okay, then you take your needle. Break the seal, you listen for that snap, you put it in, you turn, you want to make sure that you are screwing it on correctly, threading it correctly, and then it's on nice and tight. Okay. Next part that you're going to do is you're going to engage the syringe. You always want to have the barrel towards towards your palm and the cartridge, the glass part, away from you. So in case it breaks or shatters, it doesn't break in your palm. When you go to engage, you're going to use the palm of your hand, okay? And you're not going to engage just like this, kind of like, ah, or like I said, engage, okay? No, you're just going to use the palm of your hand and you're going to engage. And one of the things that, make sure I get that, you want to look for is that when you gently tug back, just gently, you can feel that it's in there nice and tight. The other thing that you'll look for to see if you've actually engaged is a little bit of the anesthetic will drop out because you've engaged and you pushed it out through the needle, okay? So if you were to use a janker, you would loosen the needle cover just a little bit, put it in there, and it's ready for your dentist off to the side, okay? If you were using the needle protector, the needle sleeve, you'd put it on, you'd loosen it up a little bit, you'd leave it off to the side for the dentist, okay? Then the dentist could use it, remove it, finish using it, then with safety, hold the end of the card and then bring it and put it on correctly, okay? So far that's good. The other part that I didn't show you, but I'm going to, we talked about it in classes, the other half of the needle cap that was used for the end of the needle that goes into the cartridge, we always keep off to the side, okay? We talked about this yesterday, how for the local anesthetic, for the topical, you want to make sure that your cotton tip applicator isn't all fuzzy, so you want to reshape it if it is, with clean gloves, of course, before you start the procedure, okay? Reshape it. You read and you know what kind of topical you're using and how long you should leave it and stuff, okay? You don't need a little, you don't need a lot, and you don't need a little. You need that Goldilocks on your tip. So you don't want to just do this and go, that's it, okay? No. And you don't want to scoop it all out. You just want to put it in there and twist it to the way you were turning it when you first did it, okay? And this would probably be enough for what the doctor may need. And if not, then they may ask you for some more. But you never go back and you double dip. You always get another cotton tip applicator. But if you're only using this one, after the doctor uses it, what you can use the end of the cap, which you're not going to need for anymore, is you can just place it in here to serve as a little holder so that it doesn't run and get all over your tray and sticky on your instruments. And then if they so do need a little bit more, all you have to do is pull it out, and whatever was left in there, you can use that, okay? Just a little FYI for that part, okay? Now to disassemble, you guys remember you're gonna have your sharps container, okay? You're going to remove the needle, okay? Take it with this. You're going to place the needle with the cap on top and then push down so you never come in contact with that needle. You just push it down, okay? Then you're going to, again, you can just hold it from the thumb ring and pull back and let it pop out, okay? Then you would go in here and toss it in the sharps container as well, because it's sharp, it's glass, okay? I'm not gonna, for purposes of video, I'm not gonna drop it in there because it's still good for demoing purposes, so I'm gonna put it off to the side, but you would throw that in there, okay? Then, again, you would put it back on the tray, take it to your instruments, and go ahead and sterilize them.